Prime Aid Health Institute and on Patient Life Matters. We've met once again to continue with our learning. NMC Code of Conduct. NMC Code of Conduct. If you remember, we have started with NMC Code of Conduct and we said they have 4 Code of Conducts. We've mentioned prioritizing people and practicing effectively. We are now under preserve safety. Preserve safety. And when you talk about preserving safety, we are talking about protecting patients from harm and reducing risk. We are talking about protecting your patient, the patient under your care, the patient that you are caring for. We need to protect them. We need to protect them from anything at all, anything harmful, and we can protect them by preventing outsiders to come in and harm them, or we ourselves harming them, our colleagues harming them, they themselves harming them, or even their family and friends, those who come to pay them a visit, from harming them. So if you try to do that, if you preserve these people, if you are preserving their safety, it means we are protecting our patient under your care. And then we try as much as possible to reduce risk on our patients. In simple terms, we are talking about speaking up if you think something is unsafe. Speak for them. Speak for our patient. As we initially said, we need to become an advocate. If you see that things are going wrong, we need to talk. If you see that things are not going on well, we need to raise it. We need to talk. We need to document it. We need to raise an alarm to our managers, to our supervisors, whoever that we are working under. We need to let them know. We need to speak up if things are going wrong, or if things are not safe for our patients. We need to speak up. Preserving or preserve safety also means that don't do things we are not trained not to do. We shouldn't do things we are not trained not to do. We need to do things we are competent in doing it. If your competency is not warranting you to do what you are intended to do, please do not do it. As we always say, because if you do it and something goes wrong, you are going to account, you are going to be responsible. And whatever effects that will come after that, you are going to be held responsible. So please, if you are not competent enough to conduct certain procedure, to do certain things for your patient, please don't. You can even do not allow your patient to even know that you are not competent in doing it. You can go and then you call any other colleague that, they've asked me to pass a cannula on this patient, but I haven't been trained to pass cannula. Can you please come and help me? And then you tell your patient that, I have called my colleague who is more competent than I in passing the cannula, and he's coming to help us so that so that you feel safe and you do not put you at risk of anything. All right, you can speak like this to our patient, and the patient will understand you, because the patient wants the best out of you. So you need to try as much as possible that if you are not trained for it, that is the reason why we were saying we need to go to school. We need to go and update our knowledge as professionals. We need to at least advance ourselves in the training that we have already acquired. We need to keep on updating it so that we become more competent. And when we are also preserving safety, it means we are following infection prevention control in our facilities. Infection prevention control in our various facilities, in any procedure that we are conducting. It could be that you are even serving a bedpan. We need to ensure that you have put on your gloves. Before you even put on your gloves, you need to wash your hands before. Wash your hand, let your hand dry before you can do what? Before you can put on your gloves, and then you serve the bedpan. Do you get it? If it is commode that you are coming to serve, the same thing. We need to make sure that hand washing becomes our habit. As WHO has given us 7 steps of hand hygiene. We need to learn it so that anytime that we are washing our hands, we employ that. When we are serving food, we need to wash our hands well. We need to put on our PPE very well so that we do not contaminate the patient food. When you finish working on any other patient, performing any other procedure, let us wash our hands before we go to different patients to prevent cross-contamination. So when we are preserving life or we are preserving safety, we need to make sure that we are preventing what? We are trying to prevent infection control. We will preserve and promote infection control measures in wherever that we find ourselves. Could be that you are working in the community. Could be that you are even working in the patient home. It could be that you are working in wherever that you find yourself, especially theaters. You need to try as much as possible to do that. Medication safety rules, we need to adhere to it. Because if you give a wrong medication to patients, you can kill the patient. It can cause a serious deformity. Sometimes it can cause permanent deformity that the patient may not even come out of it. It can end the patient's life. So you need to make sure that whilst we are preserving safety, we are also making sure that medication safety rules are being adhered to. Anytime that we are working on a patient and we see that the patient is deteriorating, let us escalate it as quickly as possible. Any deterioration in our patient, we need to escalate it as quickly as possible. We don't wait. Yesterday, the patient was able to talk. This morning, you came and the patient is finding it difficult to even open his or her mouth. There are some changes we need to make sure that we report it as quickly as possible. We shouldn't wait. Yesterday this patient was able to swallow, but today when you give anything that you give by mouth, you see that the patient will be drooling. The food will be coming back from the mouth. It is not going, which means there is a problem with swallowing. Let us quickly escalate it. So when you do this, it means, yes, we are preserving what? We are preserving safety. We need to report any mistakes that we do. If it was a mistake, it wasn't unintentional, you didn't do it intentionally, it was a mistake, please let us try as much as possible to report it. Even near misses. There was a situation that could have escalated to an accident, but it didn't happen due to your timely intervention. Let us report all of them because they could be a potential hazard to our patients. That is what you are saying. If we are trying to preserve safety, then we try as much as possible to also report anything that happens, whether it was an accident, whether it was near misses, whether it was mistakes, whether it was an incident, anything that happened, we need to report it. We need to report it correctly. This shows that yes, we are trying to preserve safety. If you do not do any of these, it means we are putting our patient's life or our patient care into jeopardy. Let us be honest in our reporting. Let us be honest. Do not let us hide anything. Even if it was our fault, do not hide anything. Let us bring everything into light. So not giving medication you were not trained to administer. It shows that you are preserving what? Safety. You have been trained to give IV medication. Do not. If you are only trained to give oral medication, give. If you are being trained to give what? Intradermal medication, give. The type of medication that you are not trained to give, please do not give. And you try as much as possible in reporting anything that you see that it is not in good shape in the facility where you find yourself. It could be the hoist that you used to hoist your patient. It is at fault. There is something wrong with it. Even a hoist must be serviced by a trained, a qualified personnel. within every 6 months. If it is not done, you need to report it that the voice has not been serviced within the last 6 months. So you can't even use it to work. We need to make sure that we are reporting everything to prevent injury from our patient and from ourselves. When we do this, it shows that yes, we are preserving safety. We need to make sure that we are escalating patient deterioration. Now NHS has developed a certain tool called News 2 chart that we use to monitor patients who are deteriorating, and then we can do proper triaging, and those who need to be escalated as quickly as possible to a higher facilities, or those that we can care for in our own facilities. In case we check the patient vital signs or patient observations and you realize that the news that we have gotten is not good, please let us escalate it as quickly as possible. Do not hide it. And when we are reporting, we need to honestly report very well. Viewers, we will end here today and we shall continue. Anytime that you come on this platform, please subscribe to it. Share to your colleagues so that they can also work professionally in our various facilities. Thank you.